Okay, so we've got the recording in progress. Welcome everyone to the Ontario Black Doula Society. Today here we've got Michelle Lee, who is one of our amazing Ryerson students that we've had the opportunity to work with and collaborate with. Today we're going to be having a conversation about perinatal mental health. For those of you that don't know, the Ontario Black Doula Society is a new not-for-profit organization looking to provide community education and support to doulas here in Ontario. For us, by us, you know the vibes. My name is Gabrielle Griffith, use they, them pronouns, and I have the honor of being the executive director at the Ontario Black Doula Society. And it is truly such an honor to be in space with all of you folks here. As I mentioned, this session will be recorded, so feel free to turn off or on your cameras as necessary. And make sure you've got your notebooks out because Michelle has some amazing gems for us. You're gonna wanna take notes. We unfortunately do not have closed captionings for this session, but it is being recorded and will be transcribed. And we will follow up with some meeting minutes to all the folks that have registered. And with that, I will pass it off to Michelle to open us up for the workshop.
Perfect. I'm just going to start sharing my screen now. Okay, can you see that?
Yes, we can.
Perfect. Okay. So good afternoon, everyone. Thanks for joining me today to talk about perinatal mental health. I'm Michelle Lee. I'm a third-year nursing student at Ryerson. How is everyone feeling today? You can unmute or type in the chat.
Very well. Thank you very much.
Okay, so today we're going to be going over some heavy information. So feel free to leave at any time as the presented information will be recorded for you to listen to when you need. So some notes for the workshop today. This is an inclusive, anti-oppressive, LGBTQ2S+ positive and trauma-informed space. Your contributions, experiences, and insights are valued. Please mute your microphone unless you're commenting or asking a question, and turn on your cameras if you're comfortable. So today's workshop will be going over the major mental illnesses that occur in the perinatal period and their treatments, how COVID-19 has affected mental health, and then we'll participate in some mindfulness activities that you can use to support your mental health. So I just want to throw out a question to you all. What do you know about perinatal mental health and mental illnesses? You can feel free to unmute your microphones or type in the chat box.
Not nearly enough is what I know.
Okay, so they're common: postpartum depression, postpartum anxiety, etc. Perfect. Not much. Only heard of postpartum depression and the baby blues. So those are very common, like the most commonly discussed ones. Often present after 3 weeks postpartum. Yeah, those are great contributions. Thank you. So something to know about postpartum mental disorders is that they're not classified as a separate disorder in the Diagnostic and Statistic Manual of Mental Disorders, the 5th version, so the DSM-5. And this is a manual that describes the criteria for people to be diagnosed with mental disorders. Another thing to note is that perinatal mental illness and health doesn't only affect the carrying or pregnant parent, it can also affect their partners, because becoming a parent is a huge transition in life that comes with its unique challenges and stress that can affect both parents. Oops, sorry. So we're going to watch a short clip about some parents' experience with mental health and barriers in seeking treatment. So when we watch, I want you to think about your own or others' perinatal mental health experience in seeking out treatment and consider the following questions. So what are some of the barriers that the woman in the video discussed? Have you experienced this yourself? And what are some other barriers that prevent parents from seeking help? Okay, just going to share. Don't think that it's working. Okay, can you see that?
Yep, I can see. We can see.
Can you hear it? Is the audio working? No.
But I think in hindsight, like my psychiatrist is amazing because from the beginning, I was so honest with her what I was thinking, and she never batted an eyelid. You know, and never. She said, "I'm not concerned about this. This is part of this is part and parcel of what you're going through," and that's such a good thing to hear.
I didn't even know how to tell anyone, and I was seeing a perinatal psychiatrist because I was being monitored because I have bipolar disorder. And when I said it to her, I said, and I tried to play it down because I thought she's gonna think I've gone crazy again. And she said, no, that's really normal.
How old was your child then?
She's maybe a few months old.
So it didn't happen straight away?
No, well, it was growing, but there was so much going on, that kind of overwhelming.
Mine came on really suddenly as well, really. Had a really lovely pregnancy, really, really enjoyed it. And I couldn't wait for my son to be born. And yeah, had a good birth, well, as good as it can be. And I was fine for about 4.5 weeks, breastfeeding. I thought, oh, I've nailed this is all right. And then I woke up, literally went to bed, and I woke up the next day, and I thought he'd been contaminated with asbestos for no particular reason, actually, just a bit of plaster had fallen down from my ceiling. From then on, like, my thoughts were around he'd been contaminated and I hadn't protected him.
And it was just like that overnight.
Yeah, overnight. And I've had problems with anxiety in my life, but I've never had intervention from a mental health team or,
Okay, so we can just have a little discussion about this video, or if you want to share your experience with perinatal mental health, feel free to unmute your mics. Okay. Yeah, that's a really good point, that the experience of mental health is not the same for everyone. Okay, so we're just going to move on. So what is perinatal depression? So we're first going to discuss what it is. So it's more commonly known as postpartum depression. So perinatal depression is a term used to describe a major depressive episode during pregnancy, which is the prenatal period, and or after the birth or adoption of a baby, which is the postpartum period. So a commonly heard term in the postpartum period is the baby blues. So it differs from postpartum depression in its length and severity. So the baby blues affects up to 50 to 80% of new parents and lasts for a few days to a week. And the symptoms of this often looks like rapid mood swings, anxiety, and crying for no apparent reason. And while the symptoms last for only a few days to a week, depression lasts for months and the symptoms often become more severe. So a significant statistic in postpartum depression is that 1 in 8 parents are affected by or diagnosed with postpartum depression within a year after birth. So this might not represent all individuals, rather only that those who have been professionally diagnosed. So we know that major depressive disorder or postpartum depression is not uncommon, but that doesn't mean that it's benign or insignificant, and that it's absolutely necessary that individuals not hesitate to seek treatment and support. In addition, prenatal and postpartum depression was evident in about 10% of partners during the perinatal period in the reviewed studies of a meta-analysis. So this means that postpartum depression is also common in the partners of carrying pregnant individuals. So the signs and symptoms of perinatal depression. So for a professional diagnosis, you have to have 5 or more of the following symptoms for at least 2 weeks. And these symptoms must cause significant impairment or distress in social, occupational, or other important daily living functions. So one of the following, so feeling sad or having a low mood, or not feeling interested in activities you used to enjoy. And then you also must have at least 5 or more of the following. So changes in appetite, so that's eating more or less than usual, trouble sleeping or sleeping too much, loss of energy or increased fatigue, feeling worthless or guilty because you believe you should be handling your parenthood better, or you feel like your child deserves better, thoughts of death or suicide. In addition, difficulty thinking, concentrating, or making decisions, crying for no reason, lack of interest in the baby, not feeling bonded to the baby, or feeling very anxious about the baby, feelings of being a bad parent, fear of harming the baby or oneself, and fear of asking for help due to judgment or fear that your baby will be taken away. So some risk factors that increase the likelihood of developing perinatal depression is a personal history of depression, history of postpartum depression with a previous pregnancy, family history of depression, excessive anxiety during pregnancy, poor social support, so social isolation, a recent move, poverty, cultural or language issues, or relationship or family conflict. So what is perinatal anxiety? Most individuals are affected by worries, but anxiety involves worries that are recurring, time-consuming, unwanted, and interfere with daily life. The way that worries differ in the perinatal period from general anxiety is that they often revolve around fears of fetal well-being, so the well-being of your child, wellness in yourself and your partner, and mortality. So symptoms of anxiety are categorized as somatic, which means physical. So these are sweating, shortness of breath, behavioral, such as avoidance of stressful situations, emotional, so that's the emotional experience of feelings such as fear or terror, and the cognitive. So those are the thoughts and the fears, as well as rumination. So the common types of perinatal anxiety disorders. There's general anxiety disorder, obsessive compulsive disorder, and panic disorder. So general anxiety disorder is characterized by persistent and excessive anxiety or worry about events or activities that causes significant distress or gets in the way of everyday life. Obsessive compulsive disorder is when repeated and unwelcome thoughts, ideas, or doubt, which are the obsessions, cause distress. People with obsessive compulsive disorder may respond to obsessions with compulsions, which are excessive behaviors or mental acts. Panic disorder is characterized by an unreasonable level of fear brought on by the anticipation of a specific situation that leads to unexpected and recurring panic attacks. So anxiety disorder is diagnosed in 4 to 39% of pregnant individuals and 16% of new parents after delivery or adoption. So the signs and symptoms of perinatal generalized anxiety disorder. So this involves anxious and excessive worry about everyday things, worry that things will go wrong even when there are no signs of trouble, feeling restless, agitated, or irritable, difficulty concentrating, difficulty falling or staying asleep, and fatigue. And then the physical symptoms can involve muscle tension, shortness of breath, rapid heartbeat, dizziness, dry mouth, difficulty swallowing, and rashes. And the worries and feelings that are common in parents with generalized anxiety disorder include worrying if you're a good parent, about your child's development, about financial issues, about something bad happening to your child, such as getting sick, abuse, or death. And these worries may manifest in behavior such as being afraid of having the baby out of your sight and waking up at night to check if your child is still breathing. As you may have noticed, there's a large overlap with symptoms of depression, and this may be because anxiety and depression are commonly comorbid in new parents, which means that they occur simultaneously. So signs and symptoms of perinatal obsessive compulsive disorder. So obsessions can include our unwanted thoughts or urges that may be disturbing to the individual. So these can include thoughts of harming someone else, fear of germs or dirt, fear of forgetting to do things, fear of illness or disease. And then the compulsions that result from obsessions can involve washing or cleaning, checking, so the baby, locks, appliances, repeating actions, requesting or demanding assurances from others, and tidying things in a particular way. And signs and symptoms of perinatal panic disorder. So panic attacks are characterized by a sudden intense fear or discomfort, and it usually peaks within 10 minutes. So the symptoms of a panic attack are chest pain or discomfort, chills or hot flushes, feelings of an unreality, fear of losing control, feeling dizzy, unsteady, lightheaded, or faint, feeling of choking, nausea, or upset stomach, heart palpitations and racing heart, shortness of breath, sweating, trembling, or shaking. So what's one thing you can do when you're facing worries that can occur with an anxiety disorder? The one thing I suggest is the guided meditation method of worry or urge surfing. So in this method, you approach your thoughts and feelings like you're surfing on a wave. So I want you to turn your awareness to the warning signs of a negative feeling, like worry, anxiety, or anger approaching. Imagine the negative emotion coming at you like a wave that gets bigger and bigger as it approaches, peaks as it reaches you, and falls as it moves away. Imagine riding that wave as it passes, and let the negative emotion go with it. Make sure to celebrate your ability to let the emotion go, but acknowledge that more will come eventually, and remember to ride the wave again when they do. So we feed urges through ruminating, so that's constantly thinking about it, giving them attention, planning to fulfill them. And urges will pass on their own if we allow them to. Suppressing a thought, feeling, or sensation might increase it, and fighting urges, even by trying to talk yourself out of them or distracting yourself from them, often makes them bigger. This method of guided meditation encourages you to approach stress and worries and urges without judgment, and to treat yourself with self-compassion by understanding that your thoughts and urges are not reflective of you, but rather are an experience. So what is perinatal psychosis? Perinatal psychosis is an acute and severe mood disorder, and episodes usually last an average length of 4 months. Because it lasts approximately 4 months, it's called acute. So these symptoms include manic symptoms, so abnormally elevated or irritable mood, intense energy, racing thoughts, and other extreme and exaggerated behaviors. So this is kind of like the opposite of depression in that you're overactive. So severe depressive symptoms, as we discussed before, and or psychotic symptoms, so that involves mood instability, delusions, including beliefs and thoughts about the baby or about birth, hallucinations, so this can be auditory or visual and sometimes tactile, and disorganized behavior in response to these psychotic symptoms. As well, individuals experiencing perinatal psychosis can have sleep disturbances, so they might not be able to fall asleep or stay asleep, as well as changes in appetite. So we're just going to do a true or false activity. So one of the major symptoms of perinatal depression is feeling sad or having a low mood. True or false? You can feel free to unmute or type it in the chat.
True.
Perfect. Perinatal depression and the baby blues are the same. True or false?
False.
False. 3 types of perinatal anxiety are general anxiety, obsessive compulsive disorder, and panic disorder. True or false?
I think that's true.
True. And mental illnesses in the perinatal period can often be comorbid. True or false? True. Yeah. So oftentimes, individuals who experience depression may also experience anxiety. Okay, so I just wanted to talk about the relationship between the COVID-19 pandemic and mental health. So we know that social isolation, which is one of the methods of prevention of the spread of COVID-19 and depression, is well known. So we know that pregnancy is a period of unique physiological, changes in levels of hormones, as well as psychosocial changes, so changes in your role, as well as your mental health. In addition, it's a stressful period with potential challenges. So this makes individuals who are pregnant and in the postpartum period especially vulnerable to the psychological effects of the COVID-19 pandemic and isolation. So this study saw that the incidence of mental disorders in pregnant people during the pandemic was much higher than that during the pre-pandemic period. So pregnant people might be stressed because of the fear of contracting infection, fear of passing infection to their child, and concerns regarding potential side effects of antiseptics commonly used during this pandemic. In addition, isolation can result in reduced family support, changes in working life, decreased household income, and social isolation, which further increases stress. So the importance of this information is that in stressful periods like the COVID-19 pandemic, it's especially necessary to seek treatment, be it from healthcare resources such as a physician or from a doula. So in another study by Rougeau et al., it's called Maternal Mental Health and Coping During the COVID-19 Lockdown in the UK. Some key themes that were established was the role of partners, family, and social networks in helping parents postpartum by providing emotional support, as well as giving time for parents to take care of their own health. It was also found that peer support for parents in the form of parenting and chest feeding support group was also associated with better mental health because relating to other parents in the lockdown was a source of empathetic support and validation. And pregnant individuals engaging in at least 150 minutes of physical activity each week during the lockdown had lower anxiety and depression scores. So what treatments are available for perinatal mental disorders? So the first option is psychoeducation. So psychoeducation entails learning about mental health disorders that occur in the perinatal period. Its aim is to help parents and their families understand the symptoms and underlying disorder, learn about available treatments, and reinforce effective coping strategies. Self-care is also another important way of supporting perinatal mental health. So the NEST acronym describes some of the major ways to do this, which we'll discuss in the coming slides. Self-care is often neglected by parents in the perinatal period, particularly postpartum, when they're focused on caring for their newborn or their family members. Self-care is about making positive changes in your life that will help to lessen the symptoms of mental illness. Psychotherapy is a general term for treating mental health problems by talking with a psychiatrist, psychologist, or other mental health provider. During psychotherapy, you learn about your condition, your moods, feelings, thoughts, and behaviors, as well as ways to cope with these. And pharmacotherapy entails taking medications such as selective serotonin reuptake inhibitors to treat mental disorders. So this is for more severe mental disorders that can't be treated using the other methods. And this requires a consultation with a physician or psychiatrist, especially when it comes to pregnancy and breastfeeding. So the self-care strategies, the NEST acronym. So this is nutrition, exercise, sleep and rest, time for self, and support. So this is social support. So nutrition, eating nutritious foods throughout the day. So a healthy body can support a healthy mind. So we want to focus on nutrient-rich foods such as whole grains, lean meats and proteins, fresh fruits and vegetables, dairy, nuts, beans, and other legumes. And we want to make sure that we get all of our required nutrients. Nutrition for chest feeding should also consist of a well-balanced diet and enough liquids. And although losing extra pounds gained during a pregnancy may be a concern, strict weight loss programs are not recommended, as the nutrition that you consume is the nutrition that is transferred through breast milk. So exercise. The recommendation is 30 minutes of moderate activity 3 to 5 times weekly. So exercises such as aerobic exercises in particular can support mental health. So this is exercises such as cardio, running, swimming, walking, hiking, or dancing. A tip is to strap on the baby carrier and take a walk with your child, or if you have one, use a stationary bike. And there's also ways to exercise with your child, like parent and child yoga classes or baby boot camps. So exercise increases the level of a certain group of hormones called beta endorphins that boosts energy, reduces feelings of anger, confusion, depression, fatigue, and nervousness. So sleep. Getting sleep might be challenging, but some tips to improve the quality of sleep include creating a relaxing sleep environment, also to sleep when your baby sleeps. So because newborns don't sleep regularly, they take frequent naps lasting anywhere from 2 to 4 hours for a total of 16 to 18 hours of sleep every day. And also to avoid replacing sleep with caffeine because you won't get well rested. Time for self. So this is participating in activities you enjoy. So using the time while newborns or children are sleeping to do the activities you enjoy. You also should set realistic expectations about home care. So your basic goal should be to make a home that provides a clean and safe environment for everyone living in it, but that shouldn't mean that you should neglect your own activities that you enjoy. So to-do lists can also help you think through what you need to do versus what you'd like to do, and that'll help you schedule in activities that you enjoy doing. And support. So it's helpful if your partner shares in physical activities and attends appointments. As well, support groups such as the Mother Matters support group, which is an 8-week online support group run by the mental health program at the Women's College Hospital, can also be a source of social support to adjust to rapid life changes that come with pregnancy and birth. So some mindfulness activities. What are mindfulness activities? So mindfulness is a type of meditation in which you focus on being intensely aware of what you're sensing and feeling in the moment without interpretation or judgment. So practicing mindfulness involves breathing methods, guided imagery, and other practices to relax the body and mind and help reduce stress. So spending too much time planning, problem solving, daydreaming, or thinking negative or random thoughts can be draining. It also makes you more likely to experience stress, anxiety, and symptoms of depression. So practicing mindfulness exercise can help you direct your attention away from this kind of thinking and engage with the world around you. And how do they help with mental health? So to improve self-efficacy, mindfulness, self-compassion, and satisfaction with life, and at reducing psychological distress by observing, acting with awareness, and not judging yourself, and treating yourself with self-compassion. So one of the activities that we've gone over already was the urge surfing, but I'd like to go over another one, which is So one of them is going to be a rage room. So I want you to think about the things that make you feel angry, stressed, or afraid. Don't judge yourself for having these thoughts, but simply observe your feeling without trying to fix them or ruminate over them. And I'd like you to mute and turn off your camera and take 60 seconds to yell or scream into a pillow, and feel free not to yell if you're not comfortable, just reflect. Okay, the next activity I'd like to go over is progressive muscle relaxation. So progressive muscle relaxation is a technique involving the deliberate stretching and relaxation of the major muscle groups of the body. And it's paired with intentional breathing. So we have an image here that I'd like you to breathe in while the image expands, and then breathe out when the image shrinks. So another piece of advice for deep breathing is to put your hands over your stomach and inhale for 4 seconds through your mouth. So feeling your stomach expand with the rise of your hands. Hold for 4 seconds, then blow out through your mouth for 4 seconds, as if you're blowing out a candle, and to hold for 4 seconds, and then to repeat. So we're gonna stretch or tense up every muscle group from your hands to the feet and your face to your whole body muscles. Okay, we're just gonna start now. So move your attention to your feet. Begin to tense your feet by curling your toes in the arch of your foot. Hold onto the tension and notice what it feels like. Release the tension in your foot. Now focus on your lower leg. Tense the muscles in your calves. Now release the tension from your lower legs. Remember to keep taking deep breaths. Next, tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together. And release. Begin to tense your stomach and chest. You can do this by sucking your stomach in. Release the tension. Allow your body to go limp. Let yourself notice the feeling of relaxation. Next, tense the muscles in your back by bringing together your shoulders behind you. Hold them tightly. Tense them as hard as you can without straining, and keep holding. Now release the tension from your back. Tense your arms all the way from your hands to your shoulders. Make a fist and squeeze up all the way up your arm. Release the tension from your arms and shoulders. Tense the muscles of your face. You can do this by scrunching up your face. And release. Finally, tense up your entire body, your feet, legs, stomach, chest, arms, head, and neck. Now release. Allow your whole body to go limp. Pay attention to the feeling of relaxation and how it's different from the feeling of tension. Okay, so now I'm just going to debrief about the activities. So I want you to share your thoughts in the chat or out loud about how the activities made you feel. And some of the prompting questions are on the screen. So feel free to talk in the chat or unmute.
I really appreciated the box breathing exercise, the inhale for a count of 4, retain the breath for a count of 4, exhale for a count of 4, and retain the breath there. I think it's helpful for centering and can easily be included and taught and learned. Like it's not too complicated. And I think for new parents, keeping things simple has a real benefit.
Yeah, and I think that when people experience stress or worry, or even like are experiencing a panic attack, oftentimes they forget to breathe regularly. So that one can, like, their breaths can be really shallow, and that might also increase your heart rate. So trying to get control over your breath again really helps to control that panic attack or stress. Any other thoughts? Okay, we're just going to move on to the feedback. So thank you for listening. If you have any feedback about how this presentation can be improved, email the Ontario Black Doula Society at hello@blackdoulas.ca, or fill out an anonymous feedback form at this link. I'm just going to drop it in the chat for you to take a look at. Thank you for your participation, everyone. And here are the references at the end, just so you can see. If anyone has any questions, just feel free to unmute. We can chat a bit. Thank you for your participation.
Should I pause the recording now just to have open discussion for the last little bit?
Yeah, that's
Okay.
okay.
So I'm going to stop the recording.